Dr. Sarah Mitchell wasn't just traveling to Atlanta that day for a medical conference, but when a passenger's heart attack turned Flight 447 into a medical emergency, 183 people discovered something that would restore their faith in expertise over assumptions. Dr. Sarah Mitchell settled into her economy class seat aboard Delta Flight 447 from New York to Atlanta with the quiet professionalism and understated confidence of someone who had spent the last 22 extraordinary years dedicating her life to saving hearts, performing complex cardiac procedures, and developing innovative treatment protocols that had revolutionized cardiovascular medicine at some of the nation's most prestigious medical institutions, where her expertise had earned recognition as one of the leading cardiologists in the United States through groundbreaking research and exceptional patient outcomes that had transformed countless lives. At 49 years old, she carried herself with the composed authority that comes from accumulating over 15,000 hours of surgical experience, completing advanced fellowships in interventional cardiology and cardiac electrophysiology, and developing expertise in emergency cardiovascular care that had made her the go-to specialist for the most complex and life-threatening cardiac conditions that other physicians considered beyond conventional treatment options. Her credentials included board certifications in internal medicine and cardiovascular disease, fellowship training from Mayo Clinic and Cleveland Clinic, and numerous professional achievements that qualified her to handle everything from routine cardiac consultations to emergency life-saving interventions involving heart attacks, arrhythmias, and cardiac arrest situations that required immediate expert medical intervention and precise clinical decision-making. Today's flight to Atlanta was taking her to the American College of Cardiology's annual conference, where she was scheduled to present her latest research on innovative heart attack treatment protocols that had reduced mortality rates by 30% through early intervention techniques and advanced emergency response procedures that she had developed during her tenure as Chief of Cardiology at Mount Sinai Hospital in New York City. Her simple navy blue dress and modest appearance reflected her preference for understated professionalism rather than obvious displays of status or authority. Though her medical knowledge and clinical expertise represented decades of rigorous training and practical experience that had saved hundreds of lives through precise diagnosis and expert treatment of complex cardiovascular conditions, Flight Attendant Jennifer Walsh, a young crew member with 3 years of airline experience who had developed certain assumptions about passenger capabilities and medical expertise based on superficial observations rather than actual qualifications or professional credentials, immediately categorized Sarah as an ordinary economy passenger, without considering the possibility that someone of her modest appearance might possess extraordinary medical qualifications and life-saving expertise. Walsh's limited understanding of medical professionals and her tendency to make judgments based on appearance rather than substance led her to overlook the quiet confidence and professional bearing that characterized someone who regularly made life and death decisions in high-pressure medical environments where expertise and experience determined patient outcomes. The busy pre-flight preparations and routine passenger interactions provided no indication that among the economy, passengers sat someone whose medical knowledge and emergency response capabilities would soon become essential for saving a life during what was about to become a critical medical emergency at 35,000 feet above the American countryside. Approximately 90 minutes into the flight, as the Boeing 767 cruised smoothly at 35,000 feet over the Tennessee mountains, passenger Robert Harrison, a 63-year-old businessman traveling to an important client meeting in Atlanta, suddenly clutched his chest with obvious distress and began experiencing the unmistakable symptoms of a massive heart attack that required immediate medical intervention to prevent potentially fatal complications. His face became ashen, perspiration covered his forehead, despite the comfortable cabin temperature, and his breathing became labored and irregular as classic cardiac symptoms developed rapidly in a progression that any experienced medical professional would immediately recognize as a serious coronary event requiring emergency treatment. "Help me!" Harrison gasped to nearby passengers as crushing chest pain radiated down his left arm and his condition deteriorated with frightening speed, creating a medical crisis that demanded immediate expert intervention and advanced life support measures that exceeded the basic first aid capabilities of typical airline crew members. Flight Attendant Walsh responded to the emergency call with standard airline protocols, approaching the distressed passenger with basic first aid training, but limited medical knowledge that was inadequate for managing complex cardiac emergencies that required specialized expertise and advanced clinical decision-making. "Sir, please try to remain calm while we assess your condition," she said, with obvious uncertainty as she observed symptoms that clearly indicated a serious medical emergency beyond her training and experience. Sarah immediately recognized the classic presentation of acute myocardial infarction and instinctively moved toward the medical emergency, her professional training and decades of experience automatically engaging as she assessed the critical situation that required immediate expert intervention to prevent cardiac arrest and potential death. "Excuse me," she said professionally to Walsh. "I'm a cardiologist, and this passenger is having a heart attack that requires immediate medical attention and emergency intervention." Walsh looked at Sarah with obvious skepticism and dismissive assessment, taking in her economy-class seating, modest appearance, and unassuming demeanor while making prejudiced assumptions about her medical qualifications and professional credibility. "Ma'am, we appreciate your concern, but we have trained medical personnel and established emergency protocols for handling medical situations," Walsh replied with condescending authority, apparently believing that someone of Sarah's appearance couldn't possibly possess the medical expertise necessary for managing serious cardiac emergencies. "Please return to your seat while we handle this medical situation according to our standard procedures and appropriate protocols." As Harrison's condition continued to deteriorate with rapidly developing symptoms that clearly indicated a massive heart attack requiring immediate expert medical intervention, Sarah persisted in her attempts to provide life-saving care despite the systematic dismissal and prejudiced assumptions from airline personnel who refused to acknowledge her medical expertise based solely on superficial judgments about her appearance and economic class status. "This passenger needs immediate cardiac assessment and emergency intervention," she explained with professional urgency and medical authority that should have immediately established her credibility and expertise. "I can provide emergency cardiac care and potentially life-saving treatment if you allow me to examine him immediately." Walsh continued her discriminatory resistance to medical expertise, apparently prioritizing her own limited authority over passenger safety and emergency medical care that could determine whether Harrison survived this cardiac event. "Ma'am, I told you that we have appropriate procedures for medical emergencies, and I need you to return to your seat immediately," she insisted with obvious hostility and professional arrogance that demonstrated her complete lack of understanding about emergency medical priorities and life-saving intervention requirements. Other flight attendants who had gathered around the medical emergency appeared to support Walsh's dismissive approach, creating a systematic pattern of medical discrimination that prevented qualified emergency intervention during a critical situation where every minute of delay increased the risk of permanent cardiac damage or death. Sarah observed with growing alarm and professional frustration how the airline crew's prejudiced assumptions and institutional biases were directly interfering with emergency medical care that could save Harrison's life. though she remained committed to providing assistance despite the discriminatory obstacles being placed in her path. Please understand that time is critical during cardiac events, she continued with calm medical authority and obvious expertise. This passenger's symptoms indicate acute coronary syndrome that requires immediate intervention to prevent cardiac arrest and potential death. Other passengers began witnessing the developing conflict between Sarah's obvious medical knowledge and the crew's systematic refusal to accept her expertise, with several travelers expressing confusion and concern about why qualified medical help was being rejected during such an obviously serious emergency situation. Among the observing passengers were individuals with medical backgrounds who began recognizing Sarah's professional competence and appropriate clinical assessment of the emergency situation. Though they remained hesitant to directly challenge the airline crew's authority during what was becoming an increasingly tense confrontation between medical expertise and institutional prejudice. As Harrison's cardiac condition continued to worsen, with symptoms progressing toward potential cardiac arrest, his breathing became increasingly labored. His skin took on a dangerous blue tinge indicating inadequate oxygen circulation, and his level of consciousness began to decline in a pattern that any experienced medical professional would recognize as impending cardiovascular collapse, requiring immediate expert intervention and advanced life support measures. "Please, someone help him," pleaded Harrison's wife, who was traveling with him and becoming increasingly frantic as she witnessed her husband's obvious medical distress and the airline crew's apparent inability to provide adequate emergency medical care. "He's getting worse, and I don't think they know what to do." Sarah continued her professional attempts to provide life-saving medical intervention, despite the systematic obstruction from airline personnel who seemed more concerned with maintaining their authority than ensuring passenger safety and appropriate emergency medical response. "This patient is developing cardiogenic shock and needs immediate medical intervention," she explained with clinical precision and obvious expertise that should have immediately established her medical credibility. Without proper treatment, he could go into cardiac arrest within minutes. More passengers began expressing concern and confusion about the developing situation, with several individuals questioning why the airline crew was refusing medical assistance from someone who clearly possessed advanced medical knowledge and appropriate clinical expertise for managing cardiac emergencies. "Why won't they let the doctor help?" asked one passenger loudly enough for surrounding travelers to hear. "Can't they see that man is dying while they argue about procedures?" Flight attendant Maria Rodriguez, a senior crew member with 8 years of airline experience, who had witnessed the entire confrontation with growing concern about the medical emergency and the crew's inappropriate response to qualified medical assistance, finally approached the situation with obvious worry about passenger safety and potential liability issues. "Jennifer," she said quietly to Walsh, "maybe we should let this woman help since she says she's a doctor, and the passenger is obviously in serious condition." Walsh responded defensively to Rodriguez's suggestion, her explanation revealing both her stubborn adherence to discriminatory assumptions and her dangerous prioritization of authority over passenger safety during a life-threatening medical emergency. "Maria, we have protocols and procedures for medical situations, and we can't just let any passenger who claims medical knowledge take control of emergency situations," she replied with obvious irritation and continued resistance to acknowledging Sarah's medical expertise. Harrison's condition reached a critical threshold as his cardiac symptoms progressed to severe distress with irregular heartbeat, dropping blood pressure, and signs of impending cardiac arrest that required immediate expert medical intervention to prevent death. While the airline crew's continued resistance to qualified medical assistance created a dangerous situation where institutional prejudice was directly threatening passenger survival. "His pulse is becoming irregular and weak," Sarah announced with professional urgency as she observed from a distance the classic progression of acute myocardial infarction toward potentially fatal complications. Without immediate medical intervention, this passenger will likely experience cardiac arrest within the next few minutes. The gravity and medical precision of her assessment began to penetrate the awareness of surrounding passengers and crew members who started to understand that they might be witnessing a preventable death due to systematic refusal to accept qualified medical expertise. Dr. James Chen, a psychiatrist traveling in business class who had been observing the medical emergency with growing concern, finally approached the situation to add his professional voice to the urgent need for immediate medical intervention. "I'm also a physician," he announced to the airline crew, "and I can confirm that this woman's medical assessment is absolutely correct. This passenger needs immediate cardiac care, and we should be grateful that there's a qualified cardiologist on board who can provide life-saving treatment." His professional endorsement and obvious medical credentials created additional pressure for the airline crew to acknowledge Sarah's expertise and allow appropriate medical intervention, though Walsh continued her resistance with stubborn adherence to discriminatory assumptions. "Dr. Chen, we appreciate your medical opinion, but we have established protocols for handling medical emergencies that don't involve turning control over to passengers who may not have appropriate credentials or experience," she replied with defensive authority that demonstrated her continued prioritization of institutional control over passenger safety and emergency medical care. Sarah watched with professional horror and growing desperation as valuable treatment time continued to slip away while Harrison's condition deteriorated toward potential cardiac arrest, understanding that each minute of delay significantly reduced the chances of successful resuscitation and survival if he experienced complete cardiovascular collapse. "Please understand that during cardiac events, time equals heart muscle," she explained with clinical authority and obvious expertise. "Every minute of delay increases permanent cardiac damage and reduces survival probability. This patient needs immediate intervention now, not after we finish discussing procedures and protocols." The medical urgency in her voice and the precision of her clinical language began to create doubt among some crew members about the wisdom of continuing to refuse qualified medical assistance during such an obviously critical emergency situation. Dr. Chen, recognizing the critical nature of the medical emergency and the dangerous consequences of continued discrimination against qualified medical expertise, took decisive action to support Sarah's professional credentials and medical assessment while directly challenging the airline crew's inappropriate prioritization of authority over passenger safety and life-saving intervention. "Flight crew, I need you to understand that Dr. Mitchell is providing accurate medical assessment of a life-threatening emergency," he announced with professional authority and obvious medical credibility. "As a physician myself, I can confirm that her evaluation is correct and that immediate cardiac intervention is essential for this passenger's survival." His intervention created a shift in the situation as other passengers began to understand that two qualified medical professionals were being systematically prevented from providing life-saving care during a critical emergency that could result in preventable death due to discriminatory assumptions and institutional prejudice. Flight attendant Rodriguez, who had been growing increasingly concerned about the medical situation and potential consequences of refusing qualified medical assistance, finally took initiative to challenge Walsh's discriminatory decision-making. "Jennifer, we have two doctors telling us this is a life-threatening emergency, and this passenger is obviously getting worse," she said with obvious concern and professional responsibility. "Maybe we should let them help instead of risking a passenger's life over procedures and protocols." Walsh found herself increasingly isolated as more crew members and passengers began to question her refusal to accept qualified medical expertise during such an obviously critical situation, though she maintained her discriminatory stance with defensive rationalization. "I understand everyone's concern, but we have legal liability issues and established procedures that we need to follow during medical emergencies," she replied with obvious uncertainty and defensive posturing that revealed her growing awareness that her decision-making was becoming increasingly difficult to justify. Sarah observed the developing situation with professional patience and medical focus, understanding that the critical nature of Harrison's condition would soon make the need for expert intervention undeniably apparent to everyone involved. "I respectfully request permission to assess this passenger's cardiac condition and provide appropriate emergency medical care," she said with calm professional authority and obvious medical competence. "I have 22 years of cardiology experience and the expertise necessary to potentially save his life." The combination of her professional demeanor, medical expertise, and obvious competence began to create pressure for the airline crew to acknowledge her qualifications and allow appropriate medical intervention before the situation progressed to irreversible cardiac complications. Harrison suddenly collapsed completely as his cardiac condition progressed to full cardiovascular emergency with loss of consciousness, irregular breathing, and signs of impending cardiac arrest that created an unmistakable life-threatening situation requiring immediate expert medical intervention that could no longer be delayed or denied without risking obvious liability for preventable death. "He's going into cardiac arrest," Sarah announced with professional urgency and medical authority as she recognized the critical threshold that demanded immediate action, regardless of institutional resistance or discriminatory policies. "I need to provide emergency cardiac care immediately, or this passenger will die." The severity of the medical crisis and the obvious expertise in Sarah's clinical assessment finally overcame the airline crew's discriminatory resistance, as the reality of potential passenger death during flight became an undeniable priority that superseded procedural concerns and prejudiced assumptions about medical qualifications. "Dr. Mitchell, please help him," Rodriguez said with obvious relief and professional gratitude as she finally acknowledged Sarah's medical expertise and the critical need for immediate intervention. "We'll provide whatever assistance you need for emergency medical care." Sarah immediately took control of the medical emergency with the confident expertise and clinical competence that characterized someone who regularly managed life-threatening cardiac situations in hospital emergency departments and intensive care units where split-second decision-making and precise medical intervention determined patient survival outcomes. "I need the medical kit immediately, and please ask if there are any other medical professionals on board who can assist with emergency cardiac care," she directed with professional authority and obvious medical knowledge. "We need to establish IV access and prepare for potential cardiac resuscitation if his condition continues to deteriorate." Walsh watched with obvious discomfort and growing awareness of her mistake, as Sarah's professional competence and medical expertise became immediately apparent through her confident management of the cardiac emergency and precise clinical decision-making that demonstrated years of advanced medical training and practical experience. "Dr. Mitchell," Walsh said with obvious embarrassment and belated recognition, "I apologize for questioning your medical credentials. Please let us know how we can assist with this emergency situation." Sarah focused entirely on the medical emergency with professional concentration and clinical expertise, quickly assessing Harrison's cardiovascular status and implementing emergency cardiac care protocols that required immediate intervention to restore adequate circulation and prevent permanent cardiac damage or death. His pulse is weak and irregular, indicating significant cardiac compromise, she explained while performing rapid clinical assessment and emergency intervention procedures. We need to administer emergency medications and prepare for potential cardiac resuscitation to restore adequate heart function. As Dr. Mitchell assumed complete medical control of the cardiac emergency, her extensive expertise and advanced clinical skills became immediately apparent to everyone on board as she deployed sophisticated diagnostic techniques, implemented precise emergency treatment protocols, and directed comprehensive cardiac care that demonstrated the extraordinary level of medical knowledge and practical experience that had been systematically dismissed by airline personnel based on discriminatory assumptions and prejudiced judgments. Patient is experiencing acute anterior myocardial infarction with signs of cardiogenic shock requiring immediate intervention, she explained with clinical precision and medical authority that established her expertise beyond any possible doubt. I'm administering sublingual nitroglycerin and aspirin while establishing IV access for emergency cardiac medications. Her detailed medical knowledge and confident emergency intervention techniques revealed the depth of her cardiovascular expertise as she quickly stabilized Harrison's condition through expert application of advanced cardiac care protocols that required years of specialized training and extensive practical experience to execute effectively. Blood pressure is critically low at 80/50, indicating severe cardiac compromise, she continued while implementing emergency treatment measures with professional competence and obvious clinical expertise. I'm administering IV fluids and preparing emergency cardiac medications to restore adequate circulation and prevent further cardiac damage. The precision and effectiveness of her medical intervention created immediate improvement in Harrison's condition as her expert cardiac care began to stabilize his cardiovascular status and prevent the cardiac arrest that had been imminent without proper medical treatment. Heart rhythm is stabilizing and blood pressure is improving with emergency treatment, she announced, with professional satisfaction and medical relief. The patient is responding well to cardiac intervention, and we've successfully prevented cardiac arrest through immediate expert medical care. Passengers and crew members watched with obvious amazement and professional respect as Sarah's medical expertise and life-saving intervention transformed a potentially fatal cardiac emergency into a managed medical situation through expert application of advanced cardiovascular care and emergency treatment protocols. Dr. Mitchell, said Dr. Chen, with obvious professional admiration, your cardiac intervention was absolutely masterful and undoubtedly saved this passenger's life through expert medical care and precise clinical decision-making. Flight attendant Rodriguez approached Sarah with genuine gratitude and professional respect, understanding that her medical expertise had prevented a tragic outcome that could have resulted from continued discrimination against qualified medical assistants. Doctor, we can't thank you enough for your life-saving intervention and medical expertise, she said with obvious relief and appreciation. Is there anything else we can do to assist with continued cardiac care during the remainder of the flight? The moment Dr. Mitchell successfully stabilized Harrison's cardiac condition and prevented what could have been a fatal heart attack through expert medical intervention. The extraordinary scope of her medical qualifications and professional achievements became apparent to everyone on board as they witnessed the direct result of advanced cardiovascular expertise and specialized emergency care that could only be provided by someone with exceptional medical training and extensive clinical experience. Ladies and gentlemen, announced Captain Rodriguez over the aircraft intercom with obvious pride and professional gratitude. I want everyone to know that we have just witnessed an extraordinary demonstration of medical expertise from Dr. Sarah Mitchell, who has successfully treated a passenger experiencing a serious heart attack and undoubtedly saved his life through expert cardiac care. The announcement created immediate recognition and appreciation among all passengers who understood that they had witnessed a life-saving medical intervention performed by someone whose qualifications and expertise exceeded anything they had previously encountered during routine airline travel. Walsh, who had been observing Sarah's medical expertise with growing professional embarrassment and personal shame, finally approached the situation with obvious remorse and belated recognition of her discriminatory behavior and dangerous misjudgment. "Dr. Mitchell," she said with genuine contrition and professional respect, "I owe you and this passenger a sincere apology for my inappropriate behavior and failure to recognize your medical qualifications. Your expertise and intervention saved his life, and I deeply regret my discriminatory assumptions and refusal to acknowledge your professional credentials." Sarah continued monitoring Harrison's cardiac condition with professional focus and medical dedication, while graciously accepting the crew's belated recognition and passenger gratitude for her life-saving intervention. "The most important thing is that Mr. Harrison is stable and will receive appropriate cardiac care when we land in Atlanta," she replied with characteristic professional humility and medical compassion. "I'm just grateful that I was able to provide the emergency medical assistance he needed during this critical situation." Dr. Chen stepped forward to provide additional context about Sarah's extraordinary medical qualifications and professional achievements that had made her life-saving intervention possible. "I want everyone to understand that Dr. Mitchell is not just any cardiologist," he announced with obvious professional respect and medical admiration. "She is one of the nation's leading cardiac specialists and chief of cardiology at Mount Sinai Hospital, whose expertise and research have revolutionized emergency cardiac care and saved countless lives through innovative treatment protocols and advanced medical techniques. This is why truth always comes to light, and justice always finds its way. If this story shows you that dignity and respect matter more than assumptions, make sure you subscribe to see more stories where justice prevails. Because when we stand together against discrimination, we make real change happen." Following the successful medical intervention and undeniable demonstration of how discriminatory assumptions could have resulted in preventable death during a medical emergency, Delta Airlines immediately initiated comprehensive reforms to crew training programs, medical emergency protocols, and discrimination prevention procedures that would ensure proper recognition and utilization of qualified medical professionals during in-flight emergencies, while eliminating prejudiced judgments that could compromise passenger safety and emergency medical care. Flight Attendant Walsh was immediately enrolled in mandatory diversity training and emergency medical response education that would address her discriminatory behavior and provide comprehensive understanding of medical emergency priorities and appropriate protocols for recognizing and supporting qualified medical assistance, regardless of passenger appearance or economic class status. The incident became a catalyst for aviation industry discussions about discrimination in emergency medical situations and the critical importance of recognizing medical expertise based on qualifications rather than superficial assumptions that could prevent life-saving intervention during critical situations where passenger survival depended on immediate expert medical care. Sarah's life-saving intervention and professional expertise became a model for effective emergency medical response throughout the airline industry, as documentation and analysis of her cardiac care techniques spread across aviation medical networks and training programs, inspiring airlines worldwide to improve their recognition procedures and ensure appropriate utilization of medical professionals during in-flight emergencies. Within weeks of the incident, Harrison had made a complete recovery from his heart attack and personally thanked Sarah for her life-saving intervention, while Delta Airlines implemented new protocols requiring immediate recognition and support of qualified medical professionals during emergency situations, regardless of their travel class or appearance. The transformation extended beyond individual airline policies to influence broader conversations about discrimination in emergency medical care. The importance of recognizing professional expertise regardless of demographic characteristics, and the critical need for institutional changes that would ensure optimal medical response during emergency situations that could determine life and death outcomes for passengers who depended on immediate expert intervention. Medical organizations and aviation safety agencies recognized the incident as a powerful example of how discrimination could interfere with emergency medical care, and used Sarah's experience to develop training programs and protocols that would prevent similar discrimination and ensure appropriate recognition of medical expertise during critical situations. Dr. Mitchell's story became an inspiring example of how medical knowledge and professional competence could triumph over institutional bias and discriminatory assumptions while creating opportunities for systematic improvement in emergency medical care that benefited countless future passengers who might require expert medical intervention during flight emergencies. The lasting impact extended far beyond aviation medicine to influence how emergency medical services, hospitals, and healthcare organizations approached questions of diversity, recognition, and optimal utilization of medical expertise that could save lives and advance emergency medical care through professional cooperation and mutual respect for qualifications and experience, regardless of traditional barriers and prejudiced assumptions. Harrison's survival and complete recovery served as powerful testimony to the life-saving value of expert medical intervention and the dangerous consequences of discriminatory assumptions that could prevent qualified medical professionals from providing emergency care during critical situations where expertise and immediate intervention determined patient outcomes and survival probability. But Dr. Mitchell's story is just one example of how truth always comes to light in critical moments. Next video. Watch what happens when a black trauma surgeon's 18-year secret is revealed during an airport medical emergency. When security blocks her from helping, the most shocking medical credentials in healthcare history are exposed. You won't believe what happens when lives hang in the balance. If you enjoyed this video, please subscribe and turn on notifications for new content. Don't forget to hit the like button if this story moved you, and share your thoughts and opinions about this situation in the comments below.